Yeah, a lot of kids will say that they use in order to feel normal,
Okay.
in order to get the urge or the self-confidence to talk to a girl or to go
Okay.
to a dance and dance or whatever it may be. So it becomes more of a normal part of their life.
Yeah, sort of just to do life. How about this business of using in the daytime? My understanding is that would be like what, before school or
Before school,
at lunch or
at lunch, during school, in between classes.
okay.
Yeah.
So that would speak to, in fact, drugs and alcohol being present on our campuses.
Right, right.
Okay. And I know there's been a lot of talk in the media about that and how to control that and that sort of thing. As your experience as professionals, how well are we doing keeping our drugs and alcohol off campuses?
Well, based on the number of referrals that we get from schools where kids have actually been caught under the influence or caught with drugs at school, we need to do a little bit of a better job. Some schools are better than others because they're educating their counselors and teachers, and so they know what to look for.
Okay.
And that's probably the key. But we probably still have a little bit more work to do on that corner.
Okay. Well, and you know, what I remember about that sort of thing, too, is you know, part of being an adolescent is the experience of doing something without getting caught. I mean, that's part of
Right.
what's fun about it. So I would imagine the daytime use would be part of what's addictive, which is doing something that feels risky.
And I think for our schools and for other mental health professionals and people in the community, not being afraid to approach somebody and say, I'm worried about you. And maybe referring the child for an evaluation so that we can rule that out. Sometimes parents are like, oh no, I can't believe he would do that. He's doing so well in school. But you just want to rule that out.
Okay. Well, and that's true. An evaluation does do both, doesn't it? I mean, the assumption is that if I'm going for an evaluation, I probably have a problem. Let's take a look at the second half of our middle stage descriptors here and see if these look familiar. We have, let's see, that looks like a very similar list. The use of harder drugs. Then we have the onset of memory blackouts, lying in defiance towards the family. Feelings of guilt may begin, decrease in school and work performance. School activities dropped. Fighting with others or sexual acting out. Now this half of the middle stage symptom kind of looks like the what we often think of and we read in the newspaper as sort of the stereotypical truant acting out kid that goes to juvenile hall. I mean, is that what you might be seeing as the disease progresses?
Yes, it's probably about half and half. A lot of our clients do end up in juvenile hall because of these behaviors, but also a lot of our clients are protected by their parents, and so if they get arrested or go to school, they're not suffering the consequences, which sometimes helps it progress into addiction a little bit more or a little quicker.
Okay, well that makes, well, but in terms of the lying and defiance, I mean, this is something that I know as a family counselor or a marriage counselor, often parents will talk about. How much of lying and defiance is about addiction and how much of it's that I'm 15 and I'm trying to get my own identity? I mean, how do you tell the difference there?
Again, I would probably want to do the ruling it out thing first. I mean, if you see somebody lying in defiance and not coupled with these other behaviors, then perhaps that's just some adolescent rebellion. But if you see the school performance dropping, that's a huge red flag, because the bottom line is it's my job to go to work today, every day, your job to go to work every day. It's a kid's job to go to school every day. And if they're failing that, that's a big red flag, and you have to rule out the possibility of alcohol and other drugs being involved.
Okay. How often, when confronted, at least at this stage, in terms of middle stage, do the kids actually admit they have a problem?
In the middle stage, it's probably not too high. What we normally get is, I use because I like it, I have fun, I can control it, it's no big deal. Most kids will minimize. They'll say, I am using, but they won't give you the full extent of what they're using. And so that's what we normally see, but it depends. By the middle stage, usually the parents or the school or the therapist or somebody has some kind of proof that they're using something because of the behaviors. And so, most of the time they minimize.
Can we advocate drug testing also? A lot of parents don't like to drug test because they think that means, gee, I don't trust my child and that's going to make him or her really angry. When in actuality, if they're doing poorly in school, running away, being verbally abusive, if there's fights within the family and all that, the trust has been broken in this family, and we want to get, regain trust. And one way to do that is by making sure the child is in fact clean and sober.
Well, and I imagine too that a lot of that is the parents are afraid they'll turn up with a dirty test because, then there's no way around it. I have to deal with it. And it's so much easier, I would imagine, to chalk things up to kind of adolescent testing than to have to say, gee, my child has a medical disease. My child has the disease of alcoholism or addiction. Now, let's take a look at late stage. Let's say we haven't caught the addiction yet. Let's see then what happens. Well, they become preoccupied with the next high. School becomes dropped entirely. Unable to maintain jobs, even part-time jobs. Drugs are used to escape self. Blackouts increase. And they begin to have unreasonable resentments. Let me take a look here. And then we'll take a look at the second half of the late stage here in a minute. But in terms of preoccupied and unable to maintain jobs, what happens with kids? Let's say a 16 years old, addict, alcoholic kid, not going to school. What do the parents do with a child like that? And how do you help families with this situation?
Well, we usually recommend that the parents say to the child, I love you, but we can't continue living like this, so you have a choice. And you want to give the child what's called a forced choice. You can either go with me to get an evaluation, or go to counseling, or go to 12-step meetings, whatever the requirement is. Or maybe you can go stay at Aunt Judy's or a teenage shelter, or we really promote tough love principles because what that does is it kind of is the reality check for the kid where they start to go, wow, I guess the way I'm acting really is affecting other people, and I guess I really do need to get some help around that. And I think by going through an evaluation, they can do it in such a way that it's not attacking, there's no shame or blame, and they can start to open up and take a look at these issues that causes them to want to self-medicate to begin with, because that's what using is really all about. Okay.
So how often, when the parents say, well, you might need to go live at Aunt Judy's house, does the kid really get it, or do they need to try Aunt Judy's house first before they get it? In your experience?
Yeah, it really depends on individual cases. I've seen, where parents said, hey, I love you, but we can't live like this. Something has to give. This is your choice, A or B. And the kid will be very upset and okay, well, I'll choose A, what mom and dad wants me to choose, because they want to stay in the home. Because, what we say is, as long as someone has a roof over their head, clothing on their back and food in their stomach, they're being taken care of. They're not going to stop their behaviors. But when you threaten to take that away, or the comforts that they're used to, then sometimes it's enough to jar them, into opening up. But we've also had kids who say, fine, I'll go live at Aunt Judy's, or I'll go live at a shelter. And those are the kids who usually end up breaking the law because they're having to struggle with finding food and shelter and those type of things. And they usually get in trouble. And then eventually they'll end up either coming into treatment, or then they'll do what the parents originally asked them to do.
Okay. How do you work with the parents? It must be incredibly difficult for a parent to say to their child, you have to go live somewhere else. I mean, I can't imagine in a way something more difficult. Now, on the one hand, it might be a relief for them to go live somewhere else, because at that point everybody's probably pretty tired and pretty battered. But that must be a real struggle for parents. I mean, it probably takes a while to get there.
It does. It takes a lot of coaching. And one of the things that we emphasize is that you want to give the young person or the adolescent a choice. The parents aren't saying, you can't live here, go live with Aunt Judy. They're saying, I love you. These are the rules that you're going to need to follow if you want to live in my house. Now, you have the choice to follow these rules and stay here, or you choose to live somewhere else. And then when you decide that you want to follow my rules, you can come back home. And so it is difficult for parents, but we do a lot of coaching. And normally by the time the parents get to that stage, they've tried everything else. And so as painful as it is, they're willing to give it a try if it's going to help their family.
Okay. Now, in terms of how you actually do treatment with adolescents, somebody comes in, they have an assessment, I'm sure just very much like a grown-up, and then they're placed in treatment. You have, here in San Jose, it's outpatient treatment, is my understanding, right? And then in Stockton is your inpatient?
The inpatient program is in Oakland, and then we have
okay.
satellite facilities in San Jose and Modesto.
Okay.
Yeah.
But we don't actually provide formal outpatient here. The program Thunder Road is always an inpatient program. What we have at the satellites are free evaluations, a Monday night class that's 10 weeks in length, referral sources, and then if the child is admitted into our Oakland facility, we bring them down here once a week for the family therapy, and all the continuing care, aftercare, is done at the satellite program.
Okay. Could parents continue to receive help through your treatment center if their child, say, participates for a week or so and runs away, like decides, I'm not doing this? Could the parents continue to get some help with you?
They can. They can continue to come to the 10-week drug education series, which is an hour of lecture and an hour of group, so they can get support with other parents who are sort of in the same boat.
Yeah.
If their child does go through treatment and, let's say, makes it through the inpatient but doesn't finish continuing care, we've had many parents who graduate from continuing care and they go through treatment, but their kids unfortunately don't make it through. And then we try to refer them to, you know, Tough Love and Al-Anon and Nar-Anon meetings, self-help groups that they can get some support from other people.
That must be such a comfort to them to meet other parents who have the same struggle, because every parent I've met in this situation really goes through a period of, you know, I'm a bad parent, what could I have done? Maybe it's because I worked, maybe it's because I didn't work. That, you know, that must be a pretty normal experience.
It is, it is.
Yeah.
And parents, once they get, by the time we see a family and they're ready to get in treatment, they've been through quite a bit, and the parents have been through that, and sometimes we have to do a lot of talking. You know, it's not your fault. You know, kids will experiment. As Elizabeth said earlier, we never know who will become an addict and who won't.
Yeah.
And so we do a lot of education with the parents. That's why Thunder Road is a family program. We're not only treating the identified patient, but we're treating the entire family.
Now, one of the things that we do with adults in treatment is we talk a lot about, you know, the physical complications. I would imagine with adolescents who are still immortal at that point, how effective is it to talk about the disease concept with somebody who thinks they'll live forever? I mean, is that more of a challenge?
Yeah, I would say it's a bit more of a challenge, but I think where we hone in with the kids is that they start understanding that they need to own, you know, their part in all of this, and that we want them, again, to suffer the consequences, so they realize, wow, you know, if I do this, then this is going to happen. We had one parent who, her son would, you know, become very intoxicated on Friday nights, and so she would do his paper route on Saturday morning. When we said, you know, don't do this paper route, but he'll get fired. Yeah, you know, and so usually it's the consequences that I think help the kid, and also the peer support. There's a lot of kids out there working a real strong program. There's young people's 12-step meetings all over the Bay Area, and so their peers are going to be a real big help to them.
That's an important place to close.
Absolutely.
There is help. Thank you for coming down today. I appreciate it.
Well, thank you for having us.
And thank you for joining us. Join us in the next few weeks as we profile step families and financial recovery. I'm Mary Crocker Cook. Good night.